To call if you have a question or comment or something else, 1-800-848-9222. 1-800-848-9222. Here's the man with the golden voice. For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. At Radiosurgery New York, the radiosurgery pioneers, that's our goal too. We're first in America, first in New York, first for you with body radiosurgery. We hit your cancer from head to toe with no cutting, no bleeding. We have decades of experience with primary and metastatic, large or small cancers. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are the best results and quality of life. Hi, I'm Dr. Gil Lederman. For a free booklet and DVD, call 212-CHOICES. 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. We're super convenient, Broadway and 38th in Manhattan. Hyperthermia 2. To hit your cancer, call 212-CHOICES. 212-CHOICES for Radiosurgery New York. At Radiosurgery New York, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Custom prostate cancer treatment here is outpatient and takes as little as 1 hour. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Hi, I'm Dr. Gil Lederman. Call us at 212-CHOICES, 212-CHOICES for a fresh second opinion and a free booklet DVD. Conveniently located in Manhattan at 38th and Broadway. For your custom-tailored prostate cancer treatment, call 212-CHOICES, 212-CHOICES. Cherish your life with custom-tailored prostate cancer treatment at Radiosurgery New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back, and we're going to talk about a little pill that might help a lot of you. A little pill that's probably at your home, and it may help fight cancer with data. And that's what we're talking about here, data. We don't want to talk about stuff that doesn't matter or stuff that can't be confirmed or verified. We're talking about information that can really help your life and change your life. And I want to talk about an article that was in the Boston Globe, which was a very reputable newspaper, and actually quotes doctors and research in major medical centers. The medicine is aspirin. Now, aspirin, of course, has been used for headaches and fighting heart attacks, but there's also evidence that it fights cancer. So it might sound strange to you, but yes, aspirin and cancer have a relationship, and it seems to be a beneficial relationship. Now, quoting Dr. Barone at the University of North Carolina, he says, as mundane as it is, it's an incredible drug. And he studies aspirin and cancer prevention and says that aspirin is probably good for the majority of the adult population, with groups most likely to benefit from aspirin's anti-cancer powers are those who are at extra risk for colon cancer and people between the age of 50 and 75. So it's his middle group who benefit the most. And when researchers started looking at aspirin, they found that it seemed to ward off colon cancer in those who were taking aspirin for its heart benefit. So many of us have been taking aspirin for a heart benefit for a long time, and when researchers looked at who benefited and what kind of side effects there were of aspirin, one was that the cancer rate in colon was markedly less in people who took aspirin than those who didn't. And it also seems to work in other cancers, or helping prevent other cancers, and those include stomach cancers, pancreas cancers, and looks like possibly lung and breast cancer, reducing them by about 25%. So there's a paper published in the Journal of the National Cancer Institute, so a prestigious journal that looked at results from 12 different studies around the world and found that women who took a daily aspirin were at a 20% lower risk of developing ovarian cancer than women who didn't. So it seems like aspirin is a pretty good agent. Now, most of the benefits occur years after you take the aspirin. So you may be taking the aspirin now, but you won't have the so-called benefit until you're in the 70s or 80s. But what the heck? If you can reduce the rate of cancer by 50 or 25% by taking an aspirin, it seems like a pretty good bargain. So researchers are still looking at what the best dose is. That 81 milligram, the baby aspirin, is the usual recommended dose to prevent heart attacks. It seems also to fight cancer. Higher doses may help more, but there's obviously side effects, and aspirin can cause gastric irritation, and we obviously don't want bleeding or gastric irritation. Also, it's not known how long you should take the aspirin. 5 years seems to be enough to reduce cancer risk, but maybe 10 years is even better. So those are questions that are going to be coming down the line. Why does aspirin work? How does it come that this one drug, even at the low dose, can prevent cancer when you need a very different treatment for ovarian cancer, colon cancer? This is not treatment, this is prevention. And isn't that what this show's about and our life's about, trying to prevent cancer and try to avoid all those calamities? So, why is it? Well, one possibility is that aspirin reduces inflammation. Inflammation plays a role in all these diseases, and aspirin helps reduce inflammation. It's yet to be confirmed, this is speculation, but that may be one reason. Another reason is that aspirin helps reduce clotting of the blood, which could play a role in cancer-fighting abilities. Why is it so hard to get answers about aspirin? Well, one thing is, aspirin is around us all the time. Many people take aspirin for headaches or for joint pains or for other things. It's a generic medicine. It's over-the-counter. So big drug companies don't make billions and zillions of dollars. You can go to discount stores and get 1,000 aspirin for a couple bucks. So they're not getting rich, so they're not promoting it. But gosh, if they could patent it and get rich, probably we would be all paying $1,000 a month for aspirin. Aspirin is readily available in the United States, so it's hard to compare one group of people who take aspirin to those who don't take aspirin. But if aspirin can help 1 in 4 people avoid cancer, why doesn't it help the other 3? Well, researchers are looking at that question. Can we extend the benefit to more people with fewer risks? So the bottom line is, while aspirin is effective at lowering cancer risks, there may be other ways to accomplish the same goal. If you want to reduce your cancer risk by 50%, you can. Stop smoking, drink only in moderation, eat healthy foods, exercise, and avoid obesity. So we want to get the patients as healthy as possible. So you can do things: stopping smoking, drink in moderation, healthy foods, exercise, avoid obesity, and maybe aspirin too will help. That's new news. It's just published this week, and you can look at it online, Boston Globe, or in the medical journal I told you about. It may help you a lot. It may change your life, and hopefully it will make your life and that of your loved ones longer, better, and safer. So I want to talk about another couple patients here. If you have questions, we're live. We're at the ABC studios in the heart of Manhattan. Our number is 800-848-9222, 800-848-9222. You're welcome to call in with your comments. I want to talk about 2 patients with meningiomas. Now, meningiomas are usually benign tumors in the brain. Usually they're found when people have neurologic symptoms like weakness or numbness or difficulty with speech or moving the face, sometimes just a headache. Sometimes we find them after surgeons operate, which we'd prefer not to, but that's your choice. You have choices. We had a woman come in this week whose tumor she had a meningioma, went from 1.3 to 1.5 centimeters in maximum diameter. Now, maximum diameter is one dimension, but obviously tumors are three-dimensional objects. And when you want to know the volume of that object, it's proportional in general to the third power of the radius. So it went from 1.3 centimeters to 1.5 centimeters, and actually if you multiply out half of that diameter, so 0.65 times 0.65 times 0.65, what it was, volume, and it went up to 1.5 centimeters, which you multiply out to find the volume proportionally, 0.75 by 0.75 by 0.75. Actually, even though that seems like a little enlargement of the diameter, the volume of the meningioma increased by 54% in this woman. Wow, 54%. So this woman came to us, seeing my colleague, Dr. Eisen. She's a Spanish-speaking patient, and we have special services for different languages, Spanish, Farsi, Italian, French, Hebrew, Russian, you name it. So this woman wants to stop that meningioma. She wants to avoid surgery and cutting, and that's what brain radiosurgery and body radiosurgery is about, to stop or shrink the cancer without cutting or bleeding. And most likely, our data actually has been analyzed and presented at national meetings. 97% of the time, we can stop or shrink or even make that meningia go away. Meningiomas can become aggressive or can become malignant. So we obviously want to treat that tumor while it's causing symptoms, but before it becomes aggressive or malignant and the prognosis diminishes. So this woman started her treatment. We've mapped it out. We have a group of physicists who make a stereotactic head frame of her head. It's all non-invasive. It's all painless. We then computerize the beams to hit the tumor and not harm the healthy tissues. She'll have a series of treatments, and then we'll follow her. Again, we look for that report card because we want you to know and you to have confidence in the work that we do. So again, we wish her well, and great for her. Now, I want to tell you about one more patient before we go to our break. We had another woman who came to us from Russia with two meningiomas. One was smaller, one was massive. So massive that she could barely stand up. It was invading the major blood areas in the brain. She couldn't have surgery because of that invasion of the blood areas. She didn't want to have surgery. She didn't want to go to the hospital. We treated her with fractionated radiosurgery nearly 3 years ago. She came to us with swelling and edema. She came to us falling down. And now, treated almost 3 years ago, all the symptoms have gone away. She's doing great, walking, the tumor's shrinking, the MRI follow-up show no swelling, no bleeding. We did it all without cutting, without hospital stay. We did an outpatient, so she's less likely to get super infection. She's less likely to have all the complications of a hospital. And we have her report card, and we have a happy patient, and we have a son who's in the medical profession who brought her to us because he knows about our work for meningiomas and other tumors in the brain and body. So congratulations. We'll see you back in a year. If you have any problems, call us. And patients have my number. They can call day or night. They can speak directly to the doctor, not a machine, not the student, not the resident. They can speak exactly to the doctor. We have a booklet DVD. If you want to know about our work and see examples about our work, you can just call us at our office, which is 212-CHOICES, 212-CHOICES. We're going to now go to a short break, and we'll be back to take your calls and talk about more health and cancer news. Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom tailored for you. Call